Welcome to today's video about nerve damage symptoms. Have you ever felt a weird tingling in your fingers and just shrugged it off? Or maybe you've experienced a sudden, unexplained change in your heartbeat. Could these seemingly unrelated symptoms be connected? Could they be warning signs that something is going wrong in your body? You're probably thinking it's all in your head or it's just stress, right? But what if I told you that, according to the National Institute of Neurological Disorders and Stroke, more than 20 million people in the United States alone are estimated to have some form of peripheral neuropathy. That's nerve damage, folks. And the scarier part? Many of them don't even know it. Today, we're diving deep into the intricate world of nerve damage symptoms. We're going to answer questions that could be the key to unlocking what's happening inside your body. So, are you ready to listen to what your body is desperately trying to tell you? Because I promise, by the end of this video, you'll see nerve damage symptoms in an entirely new light. Please note, this content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a healthcare provider regarding any medical conditions or concerns. Without further ado, let's unveil the early signs of nerve damage, beginning with number 11. Tingling or pins and needles. The sensation of tingling or pins and needles is often one of the early signs of nerve damage, and there's an interesting reason behind it. Think of your nerves as the electrical wiring of your body. They send signals from your brain to the rest of your body, and vice versa. When these nerves get damaged, the signal transmission isn't smooth anymore. It's like having a frayed wire. The electrical signals jump, miss, or get mixed up. Specifically, this sensation often arises from a condition known as paresthesia. This happens when nerve cells or neurons fire spontaneously without a clear trigger. Instead of sending accurate sensory information to the brain, damaged nerves send confusing signals. Your brain interprets these signals as that strange tingling or prickly feeling, kind of like static on a TV screen. A 2012 study in the journal Pain noted that peripheral nerve injuries could result in spontaneous firing of neurons, contributing to these odd sensations. That's why medical experts often consider it a red flag. It's your body's way of saying something isn't quite right with your nervous system. So if you're experiencing persistent tingling or pins and needles, don't ignore it. Next, number 10. Numbness. Numbness is often one of the first red flags of nerve damage for a simple reason. It indicates a disruption in nerve signaling. When a nerve can't relay messages between your brain and body properly, you don't feel sensations the way you should. Imagine a road with lots of potholes. Cars can't move smoothly, right? The same happens with damaged nerves. The signals don't get through as they should. This type of symptom is supported by multiple medical studies. For instance, a 2020 study published in the Journal of Neuromuscular Diseases pointed out that numbness is frequently a presenting symptom of peripheral nerve disorders. It's like your body's early warning system. The sooner you recognize it, the quicker you can get to the root cause. So, if you experience unexplained numbness, don't brush it off. It's your body telling you something's off track, and it's worth listening. Next, number 9, muscle weakness. Muscle weakness crops up as an early symptom because nerves are the messengers between your brain and your muscles. Think of nerves like a delivery system. When the nerves are damaged, the messages get delayed or lost. It's like your mailman going on a detour. Your packages, or in this case, muscle commands, don't arrive when or where they're supposed to. Specifically, the peripheral nerves that govern muscle movement are called motor nerves. When these are compromised, even slightly, you're going to feel it in the form of muscle weakness. Your muscles aren't getting the full memo from your brain on how to contract correctly. This is often studied in medical research, such as articles published in the Journal of Medical Science, 2023, showing that nerve damage can directly result in varying degrees of muscle weakness. So, muscle weakness isn't just a random symptom, it's a red flag. It's your body's way of saying, hey, the communication lines are down, and we need to fix this. Next, number 8. Muscle atrophy. Muscle atrophy usually kicks in when the nerves responsible for stimulating muscle contractions are damaged. Think of nerves as electrical cables. They carry the electrical impulses that tell your muscles to contract. When a nerve is damaged, that signal is disrupted or weakened. Your muscles don't receive the workout signal they're used to, causing them to weaken and eventually atrophy or shrink in size. Medical research indicates that this process can happen fairly quickly. One study from the Journal of Frontiers in Physiology, 2018, suggests that noticeable muscle atrophy can occur within 2 to 3 weeks of nerve damage onset. It's not just about weaker muscles. This affects your ability to do everyday activities. Simple tasks like lifting groceries, climbing stairs, or even walking become progressively difficult. So, muscle atrophy serves as an early warning sign. Next, number 7. Sensitivity to touch. Nerve damage can manifest in various ways, and one of the earliest signs might just be sensitivity to touch, known medically as hyperesthesia. Why's that? Well, imagine your nerves as communication pathways. When these pathways experience damage, even a gentle touch can get misinterpreted as a more intense or painful sensation. Research from the Journal of Neuron, 2007, revealed that damaged nerves often have a lowered threshold to stimuli. Essentially, it takes less to trigger them. Think of a faulty alarm system that goes off even with a light breeze. This heightened sensitivity isn't just an annoyance. It's your body ringing an alarm bell, signaling that there's a potential problem. According to a study in Neurological Sciences, 2020, such early symptoms could help in timely diagnosis, leading to better treatment outcomes. Remember, your body often communicates in whispers before it starts to shout. Sensitivity to touch might be its way of hinting at underlying nerve issues. Next, number 6. Temperature sensitivity. When you touch a hot cup or step out into a chilly breeze, your body usually knows how to interpret these temperature shifts, right? But here's the deal. Nerve damage can mess with this seemingly simple mechanism. Nerves carry signals from all over the body to the brain. Think of them as the body's communication lines. Now, specific nerve endings, called thermoreceptors, are responsible for detecting changes in temperature. Imagine these as your body's inbuilt thermometers. When these thermoreceptors get damaged, they might send faulty signals or none at all. Recent studies have shed light on this phenomenon. A 2018 publication in the Journal of Temperature found that even before major symptoms manifest, subtle temperature sensitivity changes can be an early hint of nerve issues. It's like your body's way of giving a heads up, whispering, hey, something's not right here. Next, number 5. Sexual dysfunction. Sexual dysfunction can be an early warning sign of nerve damage, and here's why. Your sexual function is, in many ways, a symphony of nerves sending signals to and from the brain. When you start to experience issues like erectile dysfunction or difficulties with arousal, it might be more than just a bad day. It could be your body signaling that something is off with your nerve pathways. Consider the process of achieving an erection for men. It's all about blood flow and nerve signals. The pelvic nerves play a critical role here. If they're compromised, you might experience ED. For women, arousal and lubrication also depend on a healthy nervous system. A study in PLOS 1, 2021, highlighted that sexual dysfunction could be an early symptom of peripheral neuropathy, particularly in people with diabetes. So, if you're experiencing consistent sexual difficulties, don't just brush it off. It might be your body's way of alerting you to nerve damage. Next, number 4. Bladder dysfunction. Our bladder relies on a delicate balance of nerve signals to function correctly. When nerve damage occurs, especially to the sacral region of the spinal cord, it disrupts this balance. Imagine the nerves as the communication line between your brain and bladder. If this line gets frayed, messages might not get through properly. A 2020 study in the journal Seminars in Neurology revealed that individuals with even minor nerve damage often experience bladder abnormalities. The body usually signals when it's time to go, but damaged nerves might either over-signal, leading to increased urgency, or under-signal, causing retention. Interestingly, another study in Research and Reports in Neurology, 2015, showed that 60% of patients with early nerve impairment reported bladder issues. Always remember, if you're facing bladder issues, it might be more than just a frequent coffee habit or aging. It could be your body's way of hinting at underlying nerve damage. Next, number 3. Digestive problems. Nerves play a crucial role in regulating gut functions. The autonomic nervous system, a complex web of nerves, controls your digestive process, from swallowing to the release of enzymes that break down food. When there's nerve damage, this signaling can go haywire, leading to symptoms like diarrhea, constipation, or abdominal cramping. One well-documented phenomenon is gastroparesis, a condition where the stomach takes too long to empty its contents, often because of vagus nerve damage. This was highlighted in a study published in the World Journal of Gastroenterology in 2020. Moreover, in the book Peripheral Diabetic Neuropathy, emphasized that up to 40% of people with peripheral neuropathy, common in diabetics, experience significant gastrointestinal symptoms. So, why should you care? Because these symptoms aren't just uncomfortable. They can be an early warning sign that requires immediate attention. If left unchecked, nerve damage can progress, causing more severe symptoms and complications. Next, number 2. Irregular heartbeat. The irregular heartbeat, as an early sign of nerve damage, is closely related to the functioning of your autonomic nervous system. This system controls involuntary actions, like heart rate and blood pressure. When nerves in this system are damaged, the heart may not receive the correct signals to maintain a regular rhythm. Damaged autonomic nerves can miscommunicate, sending scrambled or weakened signals to your heart. In response, the heart might beat too fast, too slow, or irregularly. This is no small issue. Studies have shown that autonomic dysfunction can lead to serious cardiac complications. For example, the journal Global Heart, in a 2020 publication, highlighted the correlation between autonomic neuropathy and cardiovascular risk. Understand that an irregular heartbeat shouldn't be taken lightly. If you're experiencing such symptoms, consult your healthcare provider for an accurate diagnosis and appropriate management. Next, number 1. Paralysis. Paralysis occurs when your muscles can't receive these crucial messages from the brain due to nerve damage. It's like a phone not getting a signal because of a damaged cable. Medical research has shown this. A study published in the Journal of Hand Clinics in 2015 pinpointed how damaged nerves can lead to weak or non-responsive muscles. You might think of paralysis as a complete inability to move. But in early stages, it can be subtle, like slight muscle weakness or twitching. For some, it's that odd sensation of their arm or leg not responding as quickly as usual. Remember, every person's experience can differ, and just because you feel a bit off doesn't mean it's nerve damage. But if you ever suspect something's not right, always check with your doctor. It's essential to catch and address these issues early on. Wow, what a journey we've been on today, folks. From tingling sensations to irregular heartbeats, we've navigated the maze of nerve damage symptoms. Feeling a bit more tuned in with your own body? I sure hope so. If you found value in this episode, go ahead and ring that virtual bell. No, seriously, hit that like button and ring the notification bell so you won't miss our next deep dive. And hey, we want to hear your stories. Ever had an experience that made you wonder about nerve damage? Drop a comment below and let's get the conversation started. Remember, awareness is the first step to taking control of your health. So share this video with your loved ones. Who knows, you could be their health hero. For more eye-opening health topics and answers to medical mysteries, subscribe to our channel and click on the next video. Thank you.